First is Congressman Ron Kine, who has represented the people of western Wisconsin's 3rd Congressional District since 1996. And Congressman Kine is a member of the House Ways and Means Committee and the Natural Resources Committee.
Great. Thank you, Chairman Miller, Ranking Member Keller, members of the committee. It's good to be home. In my first 10 years here in Congress, I had the pleasure of serving on this committee, and I especially appreciate
We do an inordinately good job here of training people for membership on other committees.
That's right. Well, I know the important job that you do here, and we apologize for our persistence, but we also realize that we truly are preaching to the choir here. The members of this committee certainly understands the challenge that we're facing with childhood health generally in this country, and it's obvious that we have a lot of support behind us, and you're going to hear it with the distinguished second panel, the real star power that is here today. So I'm going to try to get to the point and try to abbreviate my remarks, but you know, the number one health care crisis that our children are facing today, it's not cancer, it's not accidents, it's not drugs or alcohol or smoking. It's the advent of childhood obesity and the early onset of type 2 juvenile diabetes and all of the consequences that flow from that. And we realize, too, that we truly need a comprehensive societal approach in this country to have any meaningful impact to address this issue. Kids, wherever they are, need positive reinforcement in whatever setting they find themselves, in the home, in their neighborhoods, community, even in their schools. And the Fit Kids legislation that Zach and I and Representative Inslee have introduced with over 60 co-sponsors, many of whom are sitting here on this committee, addresses just one aspect of that comprehensive plan. I commend Representative Sarbanes for his No Child Left Inside legislation that's worthy of moving forward and getting implemented as well. It's another piece to this overall puzzle. But the trend lines have been very discouraging. And if we don't get out ahead of this issue soon, there are going to be deep societal consequences that will result. And the studies are clear, and they've been coming in by the loads. We know that increased physical activity leads to better performance in the school. We know that it's virtually impossible to develop a healthy mind without a healthy body. We know this affects kids at all ages, at all levels of development. And we know that with the right type of physical regimen in school, the teachers report back with increased disciplinary problems in the classroom, more attention, less dropout rate, higher school test scores. It's a win-win, win-win-win all the way around. And the legislation that we have offered would refocus and have a re-emphasis of physical education in our schools. And we all know that it's a patchwork out there. Some states are doing better, some school districts certainly are doing better than others. But it's not uniform throughout the country. And that's what we're trying to accomplish with the legislation. We also realize that our request to have this included in reauthorization of the Elementary and Secondary Education Act isn't going to happen this year for a variety of reasons. The initial legislation that we introduced was hoping to make this a part of the multiple measurements of progress in schools. There have been a variety of concerns raised over that issue, and we are willing to compromise, even though we feel that it was the right approach to begin with. But if by compromising we can move this legislation sooner, in fact right away, we're willing to do that and then have a broader discussion as far as how this will fit into the reauthorization of the Elementary and Secondary Ed Act when it does come up, hopefully sometime next year. But it is an overriding issue, and we're going to need support at all levels, including the celebrities of our country. And we've got Richard Simmons, who's been an absolute champion in promoting children's health throughout the country. And those of us who know Richard, you can't help but love Richard because of the energy and the compassion that he brings to the subject. And I'd venture to guess that virtually all of us in this committee room know Richard and his history and his cause to improve the health of our country. But I'll also venture to guess that the hundreds of schools that he's gone in to visit, the kids he's worked with, they don't know who Richard Simmons is. But within a couple of minutes of being in his presence, they naturally gravitate to his energy, and he's a magnet for them. And the promotion that he has done has been outstanding. I've had the pleasure of watching him on numerous talk shows promoting kids' health and fit kids generally. And the American people get it. When he tells them, the live audience, what he is up to, they typically break out in spontaneous applause because they know we need to be doing more as a country to address kids' health and also the role that physical education can provide in that. A couple of years ago when I was sitting on the committee had a hearing on the integration of classroom curriculum into PE courses. And it's exciting because this brings in all of the students. The PE today is not the PE we knew growing up. kickball, dodgeball, or organized sports. Physical education now can incorporate all kids at all levels, at all athletic abilities. And as Richard will probably testify to as well, it's a large element of self-esteem. And we also need, celebrities like Tim Brown, who's here to testify, the professional athletes in our society. Whether they like it or not, they are looked up to by our kids. I've got 2 little boys myself who idolize the Green Bay Packers and everything about Brett Favre and these sports heroes. And they pay very close attention to what they do on and off the field and what they say. And with the help of people like Tim Brown and Reggie Bush and Shaquille O'Neal and other professional athletes, we just need to penetrate this message and over again give the kids the positive reinforcement that they desperately need so that they can start making healthy lifestyle choices from day one, which will continue throughout their entire life. We know Fit Kids isn't going to be the answer to the great challenge of childhood obesity. We think it's an important part of the overall puzzle that we're trying to piece together here. And with the committee's help and with some compromise with us and working with the committee to get the legislation done in the right manner, we're hoping maybe with the limited time we have left yet this year, this might be an appropriate bill for the suspension calendar, given the wide bipartisan support that it's enjoying so far. And I just want to conclude, too, in commending the American Heart Association for the unbelievable job that they've done throughout the years as far as promoting health and children's health, but also their support for Fit Kids and the effort they've made in spreading the word throughout the country. I know we've been preaching to the choir here. You guys understand that. You know the statistics and the trend lines, and we'll look forward to working with you in the coming days to see if we might be able to get this package on the floor before the end of the session. Thank you, Mr. Chairman.
Thank you. Jack?